50 years ago, psychedelic drugs were at the center of America's counterculture, promising good trips and some very bad trips, too. Today, the DEA restricts psychedelics as Schedule I drugs with no currently accepted medical use and a high potential for abuse. But Pierce Chapin believes they saved her life.
It was very profound. It was very refreshing.
For more than a decade, Pierce struggled with severe depression, even considering suicide. Then, a nurse practitioner sent her to a revolutionary treatment at Johns Hopkins University Med Center in Baltimore, using psilocybin, a key ingredient in hallucinogenic drugs, to treat depression. Within hours, she felt relief.
I was really happy. I was seeing things a lot differently for the first time in a long time, since childhood.
Program coordinator Mary Cosimano showed us the couch where patients take a single pill. This is the session room.
This is the session room.
Then spend 6 hours listening to music with their eyes closed, closely watched by staff.
And then we put a blanket over them, just kind of tuck them in to make them feel safe and comfortable and cozy. And then we begin the day.
This is literally the room where people go on a trip.
Yes.
The latest results are eye-opening. Hopkins has treated 360 patients. For most, just 1 or 2 sessions lifts their depression for months on end. But unlike the 1960s psychedelics, the meds are clinically calculated.
Are you encouraged, excited by what you've learned so far?
Oh, I think there's nothing more interesting that I have done in my almost 50 years of doing clinical pharmacology research. There's nothing that compares to this.
The research suggests psilocybin reduces the brain's response to negative emotional stimuli. On the left, a brain before treatment. The amygdala is bright red. After treatment, it's far more muted. And this before and after scan, showing far more connectivity in the brain after treatment.
And they have this feeling of hope that they've never had before, this feeling of worthiness that they have never had before.
But the trip can also be terrifying.
It can be one of the most fearful feelings, like you're going to die, feeling like if you do let go, that you're going to go crazy.
But when it's over, an overwhelming feeling of relief.
People will have experiences that they feel are really profoundly meaningful to them and to which they attribute enduring long-term changes in positive attitudes, moods, and behavior.
For Pierce Chapin, it's meant a whole new life. After just 2 sessions, she's been depression-free for 18 months.
It's amazing. I want to wake up every day. I feel like my life has meaning to it.
Okay, a lot of caveats here. Don't try this at home. These are carefully controlled studies. Patients are vetted for pre-existing psychiatric conditions first. Just 1 or 2 pills may be able to replace daily medications for months or years on end without therapy. The results so far are so encouraging that a handful of university med centers have now joined Johns Hopkins in doing this research. And guys, one other point. This is not an addictive drug.
Well, we have so many questions.
Yes.
First of all, did I understand that right? Somebody could have a bad trip, but still receive the benefit of the long-term antidepressive benefits of this.
The bad trip could be part of the process that you're working through. And then when you come out of that trip, according to the researchers, you still feel this overall sense of relief and happiness.
What struck me was just how long it lasts. I thought it was one of those things that you were going to say, well, it lasts for a week or two.
Right.
That woman was saying a year and a half.
18 months for her. And listen, if this can be applied to other problems, not just depression, they're looking at addictions as well, addictions to drugs and alcohol as well. If that can be applied and if it can help people break these addictions, they have preliminary research to suggest, in fact, it does.
But it's just like you're sitting there. They're not talking to him. It's not hypnosis. They're not saying, it's just
not therapy,
sit there in a controlled setting.
They hold your hand. You listen to music. You trip out, literally. They keep you right there. They don't want somebody on a bad trip running out the door and jumping out of a window. They keep you there. But as you work through this whole thing, according to the researchers, people come out feeling alive again.
Wow.
Wow, that's astonishing. Well, keep us posted, Tom.
Thanks, Tom.
You didn't try it yourself.
No, don't try this at home. I didn't do it.
Okay.
All right.